start at 100.
And by the time you get to?
By the time you get to 97, the numbers will all be faded away. You start at 100, and just relax each number. Just keep that relaxation going clear down through your body. Completely relaxed. Completely relaxed. Your numbers will fade away. Your numbers are about gone. Do you have your number?
No, don't brag about that. The number's gone. That's the thing.
Is the number gone? The number's gone. You're
all right, doctor.
Relaxed. I'm going to put a local anesthetic here, and your hand will completely be numb. How does your hand feel? No.
Beautiful. I want to tell you, doctor, that was all done in 2 minutes and 38 seconds.
No,
I mean the numbness and everything. That was from the time you first began, because I got it almost from your first word. 2 minutes and 38 seconds. Excellent. All right.
Now in a moment I'll ask you to open your eyes, and you'll feel better than you felt all day, and the numbness will be gone in your hand, and you'll feel very, very good. Now open your eyes. How do you feel?
See the beautiful signs. See the signs he shows so well? Would you come up, please?
Houston, today we're going to teach you how to relax physically and mentally. Just sit in a chair, take a deep breath, and just relax. Just let your eyes close. That's fine. Let all the muscles around your eyes just relax. Around your eyes, relax. Just relax them to the point that when you try to open them, they just won't open. Just relax them. Just relax them. Try to open them, and you'll notice they just won't open. Just won't open. That's fine. Now let that relaxed feeling go all the way through your body, all the way down to your toes. That's fine. Now in a moment, I'm going to have you open your eyes, close them again. When you do, you'll notice you'll be 10 times as relaxed as you are now. So you open your eyes, shut them, and notice that relaxation. It's 10 times as great as it was. And we're going to have you open your eyes again in a moment and shut them. And you'll notice when you do, your relaxation will be 10 times greater than it has been. So open your eyes, shut them, and notice how much more relaxation you have. It's all over. Have you opened your eyes once?
No, you did it. You've done it 3 times. 3 times is enough, doctor. If he's close.
I won't have him open and shut it twice.
You all right? Okay, I'm sorry. I was so sure you'd done it 3 times that
I will have you open and shut your eyes once more. You'll notice your relaxation will be twice as great as it has been. So open your eyes, shut your eyes. Notice the relaxation you have. I'm going to lift your arm and just let it go.
Beautiful.
That's fine. You've done real well. Now you have your physical relaxation. Now we're going to get your mental relaxation for you. I'm going to have you count backwards from 100. And with each number that you count, your mental relaxation will become 2 times greater. So that by the time when you reach the number 97, you won't be able to find any more numbers. You'll be completely mentally relaxed. The numbers will have faded away. We'll start with 100. 100. You'll notice that your relaxation will be twice as great.
98. He's got it already.
That's fine. Just let the numbers fade away.
Yeah.
Just let them fade away. Just let your numbers fade away.
98.
The numbers are gone. The numbers are completely gone now. That's fine. Now we're going to use a little anesthetic here on your hand so that we can go ahead with this work. And we won't bother you at all. That's fine. Notice your hand, the whole entire back of your hand gets numb. Now your hand is numb. Feeling numbness. That's fine. Now we're all through. We've got this fixed. Your hand will no longer be numb. Tonight, I'll tell you to open your eyes, you'll feel better than you felt for the whole week. Have you opened your eyes? How do you feel?
From beginning, how was your hand, doctor? Plenty numb?
Tingling.
Yeah. From beginning to end, doctor, that was 3 minutes and 33 seconds, including rousing him from the state. So you're doing very well. Would you now work on the next one, doctor? You must have shown a nice improvement the past couple of weeks. I think you were one of those that showed a nice improvement, right? And you were one of those that I got to watch to see what caused you not improvement. Did you find out by watching that?
I think it's because I have the parents.
Oh, sure. Yeah. Okay, let's have
You work on me, or you can get some...
Yeah, go ahead. Let him work on you.
Well, I can teach you how to get medical relaxation like we know it. And to do that, I would like you to take a deep breath. Let it all out. Now close your eyes. Let the muscles around your eyes completely relax. Let them relax to the point where they just won't work. Complete relaxation. Test them and make sure that they won't work. Now let this relaxation go completely throughout your body. Your arms, your legs, all over. Complete relaxation. Now in a moment I'm going to tell you to open your eyes and close them. And as you do this relaxation will increase 10 times. Open your eyes and close them. Let this relaxation increase 10 times. Again, I'm going to ask you to open your eyes and close them. Open your eyes and close them. And this relaxation will be doubled. Let this relaxation be doubled completely throughout your body. Now once more, we're going to open your eyes and close them. And let this relaxation double itself again. Now, I'm going to test you and see if you have relaxation as I think you have. I'm going to raise your right arm, and if you do have, as I drop it, it will drop to the floor. Your relaxation is complete, and now we want mental relaxation. In order to get mental relaxation, I want you to count down from 100 to the number 97. As you reach 97, the numbers will disappear, and each time as you count down, you will double your relaxation. Count backward from 100 down, and each time you count, your relaxation will be double. Count backwards from 100 down. Count down to 97, and as you do so, the numbers will completely disappear. 99. Double your relaxation each time. 98. The numbers disappear. Let them fade away. The number 97 will be gone. Now, the numbers be gone. The numbers are gone. Now, we have some work to do today on your hand.
Now, ask him, doctor, are the numbers gone?
Are the numbers gone? We have some work to do today on your hand. And I'm going to put some anesthetic on your hand. And this will completely numb your hand. Completely be numb. Your hand is now completely numb. Our work is all done.
First ask him, how's the hand?
How does the hand feel? Warm. Now our work is all done today. Pretty soon I'm going to open your eyes. Your numbness will be gone and you will feel fine. Open your eyes. How do you feel?
Now, I want to tell you something, friends. I have watched every man, and I have particularly watched the men who said they didn't improve. And I think each man could see what he did that was wrong, that kept him from improving. For one thing, it is vitally important that you do not have the parent in the room. That could keep any doctor in this room from succeeding with a child technique. That was excellent, doctor. There was certainly nothing wrong there. The next thing is, be sure that you impress upon the child the necessity of playing the game, or else he's going to have his treatment in the ordinary way. And if he has the treatment in the ordinary way, he knows that that isn't comfortable. Now, which do you want, if the easy way or the hard way? Because you're going to have children. They're going to say, I don't want to play a game. I didn't come here to play games, and so on. And I want to make sure that every one of you understands how to handle that child so that you don't find failures. But I have been very, very happy with the way the men did tonight. How are you? How do you feel about it? There wasn't a slowpoke in the lot. And I have been timing you and getting some awfully nice timing here. I've had timings where the whole thing, anesthesia and everything, obtained in 2 minutes and some seconds, by one of the people, and 2 minutes and 20 seconds by others, and 3 minutes for the entire procedure, bringing them out of the state and everything else. And that's pretty fast work, including a test which was made during that 3 minutes. So it shows you that if you work towards time, this is the first time you ever did it, and it took 3 minutes, that as you improve, you're going to be able to get much better results. You'll find that this course deals with the 5 most common types of therapeutic suggestions. One is the immediate relief of pain or the giving of anesthesia, migraine headaches, tension states, sudden attacks such as asthma, ulcers, allergic reactions, and so on. Superficial hypnotic therapy is usually instantly beneficial. For example, how many men have already used hypnosis to remove headaches? You have over there, doctor, and you have too. And they disappeared like magic. Is that correct, doctor? And is that correct with you? But did you also know that dysmenorrhea can be made to vanish as fast as that? You did, huh? But most doctors don't know that. And consequently, they'll use it for a migraine, but some woman comes in complaining of terrible dysmenorrhea, and the doctor, it never occurs to the doctor to use hypnosis for that. You can make dysmenorrhea vanish as fast as you can migraine headache. You can also do the same thing with tension states and sudden attacks such as asthma, ulcers, allergic reactions, and so on. For example, the average doctor, when I say the words allergic reaction, says to himself, yeah, but not on such things as sulfa and penicillin. Well, I'm just going to show you something now. I'm going to bring a man up here who has a sulfa reaction. And by his report next week, I am willing to trust to his report. That's how much I know hypnosis will do the trick. I want you to see how well you get between now and the next day or so as a result of what I'm going to do now. Will you come up, please? I would use the 2-finger eye closure technique. Close your eyes, get eye closure, because he knows what eye closure is. I'm going to lift your hand, and the relaxation is going to be complete. That's right. Now start counting from 100 and make the numbers disappear even before you get to 99.
100.
Now they'll be gone. Make them disappear. They all gone? That's what I mean by shortening the shortcuts. Now, doctor, you had some sulfa drugs, and you had a reaction from it. There's an emotional content in every allergic reaction. And doctor, I'm going to take the emotion out of this present allergic reaction. And you're going to find that you're no longer going to have thoughts of how long this is going to last or how soon is it going away or anything. And you're going to find, as if by magic, all reaction that you've had to the sulfa will vanish, and you won't be worried about it anymore, and you'll know that it's going to disappear very quickly. And when you get back here 2 weeks from tonight, I want you to tell us how quickly it all disappeared. Just know this is going to happen, want it to happen, and expect it to happen, and then watch it happen. Now, when I have you open your eyes, just notice how much better you feel already. And notice how that hand, those hands, begin to feel better almost instantly as I talk. Now open your eyes and notice how good you feel. Look at your hands now, doctor, and look at them a little bit later tonight, and I think you'll be delighted with how fast we're able to solve this for you. All right, thank you very much. Now, you can remove an asthma attack faster than you can with aminophylline using hypnosis. You can remove an ulcer attack, and you can remove allergic reactions. The child who comes in so allergic, he's eaten chocolate or nuts or fish, and he's sick onto the place where he almost feels like life isn't worthwhile for him. And you can get him into the hypnotic state and say, now you're going to feel better. When I have you open your eyes, you're going to feel so much better, you won't even feel you've been sick at all. You feel so good. And instantly the allergic reaction vanishes. I want you to try it. Now, there's a second category in that first type, where dental or medical patients, where the dentist or physician must inflict the pain. Well, you've been practicing with that all night, so you know you can do that. You see, you can do these things when you get somnambulism. In many cases, you can't do it when you don't get the somnambulism. So you get the somnambulism, do what you've done tonight, and you'll find that that first type that I've mentioned will handle very easily. Number 2, the relief of chronic pain. Rheumatoid arthritis, for example, or any painful condition which persists. The itching or burning sensation of a painful skin condition. Neurodermatitis, for example, or the agonizing pain of cancer. Gentlemen, before I really had started teaching, I was invited to speak at the Passaic County General Hospital. And at that time I told them, the doctors there, that they could use hypnosis to relieve the agonizing torture of the terminal days of a cancer victim. And the way I happened to say it was something like this. Gentlemen, if you study hypnosis with me or with anybody else, don't use hypnosis just for the simple baby, the easy things. Use it for the more complicated things. Learn to use it well enough so that you can use it to relieve the agonizing torture of a cancer victim. And a little titter grew in that audience, from a little titter to a roar of laughter. And I say to you that I can still hear that roar of laughter ringing in my ears because it was so unpleasant. And after the meeting was over and I was walking home with one of the first doctors that ever studied with me, I said to him, Nat, why did those people laugh? And he said, well, Dave, don't you understand it? They've always looked upon hypnosis as just a joke, something somebody uses on the stage, but that it has a use in medicine. These people don't believe it. And he says, furthermore, he says, imagine, it's not a doctor telling them, but it's a layman telling them. And I suppose people wondered how I knew that it could be used for cancer. My father was a cancer victim. He died when I was 8.5 years of age. I saw that man, and I used to go into his room, and I used to see him going through that god-awful torture. And he used hypnosis on himself. And it was more successful than all the drugs that the doctors could give him. And in my little childish mind, as I watched my dad benefited by hypnosis, I didn't realize the importance of it then. But I thought to myself, isn't it good that he can be helped some way anyhow? And then these were the black days of hypnosis. Nobody knew that hypnosis could help cancer, and here was this knowledge stored in my mind. And when I began teaching hypnosis, it was with the thought that I wasn't just going to teach it for the baby things. I was going to teach men to use it so that they could use it on their patients as it was used on my father. And so I knew it would work. Later, as doctors began using using hypnosis for relieving the pain of cancer, it first happened in Brooklyn, where the head of the cancer division of one of the larger hospitals was my student. And he had so much success with it that the work was later continued at Francis Delafield Hospital and some other hospital there, I've forgotten which. And the Cancer Bulletin wrote an article on the work of my students. Montefiore Hospital. I don't know if you people know that name out here, but in New York that name is magic. And Montefiore Hospital set up a clinic for one of my doctors who has been so successful in relieving the agonizing tortures of cancer. Now, this does not say you're going to cure the cancer patient with what I teach you, but what you are going to do is to be able to alleviate the symptom. You won't remove it completely. He'll still know he's a sick man, but you will make his hours more comfortable. Now, how do you do it? You get the patient relaxed and into somnambulism. And here's the way I do it. I say to the patient, now look, all illness happens the same way. You have a little discomfort, and the discomfort makes you tense. And then because the discomfort makes you tense, you feel the illness more. And then you get more tense and you feel the illness more. And it's a vicious cycle. By showing you this relaxation, I've already showed you how you could feel so little. And I'm going to teach you how to relax so well that we can break up this entire habit pattern, and you won't feel things nearly as much as you have been feeling them. And I want you to notice the relief you get just as you are in this state right now. You will generally find that if you use that approach, that they'll begin saying to you, oh, I feel so much better. Oh, I feel so much better. Now hold on to that relaxation. Hold on to it. It's so important that you hold on to it. And then I'm going to have you open your eyes, but even after I have you open your eyes, stay relaxed like this. I'll be back to see you in a few days. And I want you to hold on to that relaxation until I get back here. When I get back, we'll do this again. We'll practice it all over again. And you won't have any discomfort if you stay relaxed like this. And you'll get a good night's sleep tonight. And I load them with health suggestions and so on, and then I bring them out of the state. When you do this, gentlemen, and I can only do it where I am called in by a doctor to help him with a cancer victim. But where I do this, I have found that you get such wonderful help for the patient. My wife brought up a paper on which she wrote, "Doctor has cancer patient he would like to relieve with hypnosis this week. How would you give suggestions for this?" And that's why you've heard me give the suggestions just as I would give them. Who was the man who asked that question? All right, doctor. If he is ambulatory, I would give my suggestions like this. I'd get him in the state. I'd give him the same statement that people feel things more because they get tense from discomfort. And then when they get tense from discomfort, they feel the discomfort more. Now, you can relax most of this discomfort right out of you and feel whatever is left at a very, very little level. You won't feel it. It'll be such a high threshold that there'll be no discomfort to it at all. You'll be able to go about your daily routines and everything else. So just stay relaxed now and notice the difference when I have you open your eyes. Do you follow the way that's being done now? Do it that way, doctor, and I think you'll be able to report success. I'll tell you, there are other men in this area who have used it for intractable pain. When Life magazine showed that picture of the woman before, the woman with the cancer, before the suggestions were given to her and after, they were showing absolute truth. And I gloried in that picture because I said to myself, they laughed at me. You know, they laughed when I told them it could be done. But they don't laugh anymore at it, doctor. And when hospitals begin to set up clinics to investigate the possibilities of further research with hypnosis, you know that we've got something. An awfully good way is to anesthetize an area so that they just won't feel it. And I think that one of my students up in Buffalo, New York, incidentally, he was the man that Kroger hired to teach with him in a seminar that was conducted up in Buffalo, New York, David Johnson. David Johnson tells me that when he is working with a cancer patient, and he's an OBGYN, so he only encounters it in women, but he has been able to anesthetize the entire area so that they just don't feel it. And he's told me that they know they're sick, but they do anesthetize the area so that they don't feel it. Also, a doctor would like you to repeat what you say to a patient in surgery before giving anesthesia. He wants what you did at the beginning of the class. Well, suppose we had a patient. Would you be my patient for me? Yes, would you mind? And let me show you how I would give that, because I'd like to record it here myself and have it on my own tape. We'll say that it's the night before surgery, and I might come in to you and say, what is your name, please? Nancy. Nancy, I've checked everything, and I find that you're in excellent shape for the surgery in the morning. You know that in the morning I'll be in charge of the surgery, and I want to show you how you can have such an easy time of the surgery itself. Would you like to know how? Well, to begin with, most people are terribly tense before surgery. They're wondering what's going to happen, and they're filled with apprehension and fears. Now, I bet you've had some of them, too. And the chances are that you have. Let me show you how we can get you rid of all those fears and apprehensions by showing you how to relax scientifically. Would you like to know how to do that so you can get a good night's rest tonight? When I see you in surgery in the morning, you'll be in excellent condition for it. All right. Now, take a long, deep breath and close your eyes. Now I want you to relax those eye muscles to the point where they just won't work. And when you're sure they won't work, test them. And then let that feeling of relaxation go right down to your toes. Now we're going to do that once again, Nancy, and we're going to be able to increase that relaxation 10 times over. Now open your eyes. Now close your eyes. Now let that relaxation just cover you like a blanket. Now the third time we do this, you'll be able to double the relaxation you now have. Now open your eyes. Now close your eyes. And now, Nancy, there's a little hand of yours. I'm going to lift the hand and I'm going to drop it. And it's going to be so relaxed it'll just fall like a wet dish rag. And let it be so completely relaxed that it does. Now, isn't that wonderful? Now, Nancy, when you're relaxed like this, isn't that a nice feeling? And I want you to have that feeling when I see you in surgery in the morning. Now, let me tell you something about the surgery that has to be done. You know, surgery isn't what it was many, many years ago. Now we never do surgery on a patient unless we know that the patient is ready for it. In other words, all these tests that have been made on you the past 24 hours, whatever it is, all these tests have been to determine that your body is strong enough to stand the surgery, that it's not going to be a shock to you, that it's not going to be unpleasant to you in any way, and to know that you are going to recover from the surgery rapidly. That's what these tests are for. And any pre-medication that has been given you, or that will be given you, is to make you feel good during the operation and after the operation. But if you stay relaxed like this, Nancy, why, you don't have to worry about a thing, because you'll get a good night's sleep. And when I see you in the morning, you know that when they bring you into the operating room, and I tell you to close your eyes, you'll be able to relax like this. And then the surgery will be so easy, and the anesthesia will be so easy to give to you. And you won't have to have so much anesthesia, and you'll get a better anesthesia. And not only that, Nancy, but you will recover from the operation like magic. There'll be no post-operative discomfort. You'll be surprised and amazed to see how well you get and how rapidly you get well. And now there's just one thing that I do want to talk about, and I do want you to talk about. Before we do surgery, we like to know that the mind of the patient has no hidden or mental reservations. So if there are any fears in your mind that you haven't gotten rid of, any apprehensions, any anxieties at all, Nancy, I want you to stay relaxed as you are and tell me about them. Usually the patient will say no. You're sure you're going into this operation knowing that you're going to get well in a hurry? And you know that the operation is going to be much easier on you than you think. Now, when I have you open your eyes, Nancy, you're going to be able to close them later and get a good night's sleep. You're going to be able to feel wonderful. Now open your eyes and notice how good you feel. All right. That is what I would do. Now, if it was anesthesia, I might take it from a different angle. Does that give you the answer? Was it you that asked for that, doctor? Who was it that asked for it? Fine. Does that give you your answer? You've got it on tape, I think, haven't you? Okay. Thank you, Nancy, very, very much. Remember that when you're working for the relief of chronic pain, superficial hypnotic therapy is usually highly beneficial, but the suggestions must be renewed at short intervals. You're working with ether of the imagination, and the effects of the ether in such cases is bound to wear off in times. Suppose you're working with a rheumatoid arthritic. You know that if you can relieve that patient for 2 or 3 or 4 days, you're giving that patient a lot of help. If you're working with a cancer patient and you can help them for 3 or 4 days, you're giving them a lot of help. Don't say to yourself, well, gee, I have to go back and fortify the suggestions all the time. Sure you do. You'll have to go back and see that patient again and again, but usually the terminal cancer patient is one that you go to see quite frequently anyhow. So when you see him, take the time, take 3 or 4 minutes to strengthen the suggestions, to supplement the suggestions, and you'll be as enthusiastic as Tinderow has been, who has worked with 15 cases, you told me? Is that what you said? 15 cases. And he has been successful a vast number of those times, hasn't he, Doctor? How many times of that 15, or has he been successful with the 15? Had good results in controlling pain and 15 intractable cases of pain.